All right, let's talk about safe sex. But we're going to look at it through a totally modern, kind of holistic lens. This isn't just the basic stuff. We're going to build a framework that works for literally everyone, no matter what your relationship looks like.
So let's just jump right in. When I say safe sex, what pops into your head? For a lot of us, right, it's this super narrow idea we picked up way back when.
But here's the thing. It is so much more than just that. It's not just about preventing pregnancy or STIs. Real safety is about building this foundation of trust, you know? It's about communication and just looking out for each other's well-being.
Okay, so what we're going to do is explore a completely new way of thinking about this. It's a bigger, more complete approach that really gets into all the pieces that go into having a safe and fulfilling intimate life.
And this whole framework, it's built on 4 main pillars. First, you've got your physical tools and barriers. Then there's proactive testing, which is really a form of care. Third, and this one's huge, is open communication and consent. And finally, the one we often forget, emotional well-being.
All right, let's kick things off with that first pillar, the physical safety toolkit. This is all the tangible stuff, you know, the actual tools that are our first line of defense, the real hands-on part of staying safe.
Okay, look at this chart. This is fascinating. See that gap between perfect use and typical use? It's huge. Like an external condom, 98% effective if you do it perfectly every single time. But in the real world, that drops all the way to 87%. And that 11% difference, that's life. It's things like storing it wrong, ripping the package with your teeth, or just not using one every single time. It really shows that having the tools is one thing, but knowing how to use them correctly is the whole game.
And listen, the toolkit is way bigger than just one thing. Yeah, there are external condoms, but there are also internal condoms. There are dental dams for oral sex, even latex gloves for manual play. The point is, you gotta use the right tool for the job, you know? And this is super important, always practice good hygiene. That means washing hands and sex toys between partners, and even when you're moving between different parts of the body.
Okay, so let's quickly demystify one of these tools that maybe isn't as well known, the internal condom. It's actually super effective and pretty easy to use. So, step 1, you check the expiration date, open it up carefully, and then you just squeeze this thick inner ring at the closed end, just like this, with your thumb and forefinger.
Next up, step 2. You just need to get comfortable. Maybe that's squatting, lying down, putting one leg up on something, whatever works. Then you guide that inner ring into the vagina. You can use your finger to push it in as far as it'll comfortably go, right up until it's resting against the cervix. The cool thing is, it's designed so this thin outer ring stays just outside the body.
And finally, step 3, getting it out. It's just as simple. You gently twist that outer ring to kind of seal everything inside, and then you just pull it out. And please remember, wrap it up and throw it in the trash, not down the toilet. See? Not so complicated.
All right, let's move on to our second pillar. This is where we need a major mindset shift. We have to start thinking about STI testing differently. It's not a sign of suspicion. It's just proactive healthcare. It's wellness. Just like getting a dental checkup.
So what's the general rule of thumb here? Well, the CDC recommends that if you're sexually active and you have new or multiple partners, you should get tested about every 3 to 6 months. That regular rhythm, that's the key. And why is that so important? Well, for one, a lot of STIs are asymptomatic, meaning you'd have no idea you have one. So regular testing is how you catch things early. It stops you from passing something along to a partner by accident, and it empowers you with information so you can make safer choices. It totally normalizes sexual health as just part of your overall health.
I love this quote because it just nails the mindset shift we're talking about. Bringing up testing with a partner isn't you being accusatory. It's really just a powerful way of saying, hey, I care about my health, and because I care about you, I care about your health too. It's all about mutual respect.
And that leads us perfectly into pillar number 3. And honestly, this one is the foundation for everything else. We're talking about communication and consent. Because without this, those other pillars, they just fall apart.
So here's the absolute crucial takeaway. Consent is not a one-time checkbox. It's not a simple yes or no that you get at the beginning. It has to be an ongoing, enthusiastic conversation. It's about checking in with each other, actually listening and respecting that anyone can change their mind at any point for any reason.
And how we have these conversations, it makes all the difference. Look at this example. Instead of an accusatory question like, did you get tested, which can put someone on the defensive,
Try framing it with an I statement that's all about teamwork. Something like, hey, I really want us to protect each other. I got tested last month. What about you? See that? It completely changes the tone from a confrontation to a collaboration.
This level of communication is absolutely essential if you're considering something like fluid bonding. You might have heard that term. It's basically when partners make a mutual, very explicit agreement to stop using barrier methods. But, and this is a big but, that can only happen safely after you've both been tested and had a really serious, honest talk about your relationship and any potential risks.
So your communication toolkit should definitely include a few key things. Talking about boundaries and testing history before you're in an intimate situation. Agreeing on what barriers you're going to use. Making a pact to tell each other if your risk status changes. You know, some couples even find it helpful to create a sort of relationship contract just to make sure all those expectations are super clear for everyone involved.
Okay, on to our final pillar. And this one might be the most profound of all. We're talking about emotional safety, that feeling of trust and connection that lets you be truly vulnerable, which is where real intimacy comes from.
This quote by Stephen Porges just says it all. Safety is not the absence of threat, but the presence of connection. Wow. So true safety isn't just about avoiding the bad stuff, STIs, pregnancy, whatever. It's about what you are actively building together. It's about creating a genuine connection where both of you feel seen, heard, and totally secure.
And a really big piece of creating that safety is understanding trauma. If a partner ever seems to pull away or freeze up during intimacy, it's so important to know that it's often a protective response wired into their nervous system. It is not a personal rejection of you. And just knowing that, it lets you respond with compassion instead of getting your feelings hurt.
And that leads to this really powerful shift in how we think about things. We can stop seeing sex as some kind of performance with a specific goal. Instead, we can reframe it as a journey of mutual exploration. You know, when you can just stay curious about what your partner is feeling and what you're feeling, all that pressure just kind of melts away. And what's left is connection.
So as we wrap things up here, I want to leave you with something to think about. Looking at these 4 pillars we talked about, the physical tools, the proactive testing, the open communication, and that emotional well-being, what is just one conversation, just one, that you can start today to help build a stronger, safer, and more connected, intimate life for yourself?